not to panic. He further adds that the health department has assured that there is no need for citizens to panic. As of now, no cases of HMPV have been reported in Maharashtra. My colleague Daryl Mirinda with us on the broadcast. Daryl, take our viewers through the details. What really is the health advisory that has been issued in Maharashtra?
Devika, following the outbreak of HMPV cases in China, the Maharashtra Public Services Chairman Dr. Nitin Ambedkar has issued an advisory where he said that the people of Maharashtra should not panic because of the cases which are increasing in China. The situation is under control as there are no cases found in Maharashtra, but the precautions should be taken. Advisories have been issued. Today also, when we spoke to the Dean of JJ Hospital, Dr. Palavi, she also said that the necessary precautions should be taken by the public, especially those who have low immunity and are facing asthma problems should take care while going out in public. People should use masks. Same when during the COVID-19, what precautions people were taking should take the same. Also, people who are suffering from cold, fever and the basic fever, and if the body temperature is high, they should consult their family doctors or the physicians and should take a proper medication. And apart from that, people should also wash their hands frequently with hand sanitizers or hand wash. And but right now, since there are no cases found in Maharashtra, the situation is under control, but the government has issued advisory and have asked the people not to panic and also take precautionary measures. Devika.
Okay, Daryl, thank you for joining us. There is some more news coming in. While India's benchmark indices Sensex and Nifty saw 1.6% decline, hospital stocks have attracted significant investor interest following the confirmation of 3 HMPV cases in the country. 2 cases were reported, remember, in Karnataka and 1 in Gujarat, sparking attention amid global concerns about the virus, especially following reports of its rapid spread in China. The government's confirmation of the HMPV cases has led to investors to focus on hospital stocks, anticipating a potential increase in demand for healthcare services. My colleague Belly Thomas with us on the broadcast. Belly, interesting developments taking place as far as the stock market is concerned. Take our viewers through the details.
Absolutely, Devika.
Will you be speaking about Ramesh with?
Go ahead, Belly. We can hear you.
Yeah. The cases of HMPV virus have certainly rocked the stock market, as there is a kind of a panic that has been created among people as to they have been kind of thinking that COVID-19 situation re-emerge in the country, and they were also worried about all this the travel advisories, such as there would be testings and all those things that would come up in airports and other transport hubs. So all these taken into account, there's a kind of there was a kind of certain fluctuations in the holdings of the health industry, especially the hospital businesses, and there is indeed a shoot up in the stock markets as we see, Devika.
Belly, stay on with us. Some more news coming in. We're learning that hotels and airline stocks have plunged up by moved up 6.4% after the Indian government confirmed 3 cases of the HMPV. Belly, take our viewers through the details. Like I said, interesting developments taking place. We're now learning that hotel and airline stocks are also plunging.
Absolutely. There was a kind of panicky button that was pressed when the cases of HMPV virus were detected early in Bengaluru, that is 2 infants. While the ministry took some time to confirm as to whether these the strains are really from have originated from China or not. And the ones that have originated from China are in fact fatal. And such viruses, if those strains and genomes spread in India, there would be certainly a big change in the existing social life as such. So since morning there was a lot of confusions that galloped in the hospital industry sector primarily, and with two cases that were found out by the authorities, that two infants were infected at the hospital in Bengaluru. A lot of discussions, debates, and meetings had happened, and there were kind of speculations as to whether the government would call for a lockdown, both in Karnataka and Ahmedabad in Gujarat as well. So having said that, it took certain time for the health department or the health ministry to kind of clear the air, stating that this is not a new virus that has entered the country, or this is an existing one, and the strain has already has medicines. And it is normal that vulnerable sections like a newborn or the infants will contact this particular virus, which after a certain period of time of treatment goes away, and they'll be discharged from the hospital. So all these cases put together, like in the two cases in Bengaluru and the one in Ahmedabad, Gujarat, all the cases were infants, and the government is now working on kind of a strategy to rule out or to make it possible that nobody should panic, or there shouldn't be any kind of disruptions in in the social life, and especially the stock market, as you said, started plunging, both in the hospital industry and the travel industry, including airports, Devika.